Perhaps the only thing worse than having a loved one diagnosed with a debilitating disease is not knowing where to turn for help.
Your mother's looking to you for help, your father's sick, and you want to be able to have an answer, and I had no answer.
The family of retired Philadelphia Police Lieutenant Bernie Rayner needed help finding the best specialist for him after he was diagnosed with a brain tumor. Then came the staggering news about his chemotherapy treatments.
We were sent home with a prescription for his chemotherapy. We didn't know. Off to the drugstore we go. Well, we find out that the prescription is an $8,000 prescription, and he needed it every month.
But his prescription plan maxed out at $16,000 a year. That's when Rich contacted Guardian Nurses.
They asked what drug it was. They found the pharmaceutical company that prepared it, and then they gave me all the information for the Commitment to Care program that they have there at Sharing Plow. And I wrote a letter of appeal to them, and we were accepted, and so we were able to get that treatment for a full year.
We've been doing this every day since
June 11th.
June 11th.
Maria Maldonado and her husband, David Koslow, are another example of how Guardian Nurses helps people with serious medical issues. David's throat cancer was already in stage 4 when he was diagnosed.
It's very difficult to watch someone you love get this monumental illness that truly is life and death. It's mind-boggling.
A colleague told Maria to call Guardian Nurses. Their nurse advocate immediately got David in to see a specialist who was about to leave for Australia.
Never would we have been able to get that doctor on Friday for a second opinion. I mean, I don't think it was possible, and it was only because of Guardian Nurses that we were able to do that. And to this day, my husband will say that we saved his life.
Hi. Hi, Betty.
Betty Long founded Guardian Nurses in 2003 after helping several family members and friends with healthcare issues.
Our healthcare system has become so fragmented and complex that patients who are experiencing a healthcare crisis don't have the wherewithal or the resources to be able to manage their own care effectively and safely.
Hi, this is Karen with Guardian Nurses calling. We got your request for assistance, and I'm calling to see how we can help you.
Betty and her team of experienced nurses have the clinical knowledge to help translate complicated medical information for patients and their families.
I really believe that patients need to have someone who's working on their behalf, separate from any other self-interest, to make sure that they're getting the best care for them and the best treatment.
Guardian Nurses services include advocating for patients during hospitalizations or nursing home stays, resolving billing, claims, and insurance issues, researching information about health concerns and available treatment options, seeking options for community services and long-term placements, reviewing and explaining medical records, and obtaining health equipment, supplies, and resources.
If you're a full-time benefits-eligible employee of a client of ours, we're paying for you to have Guardian Nurses.
Anthony Salucci of the Beacon Group is among a growing number of health insurance brokers recognizing the value of Guardian Nurses. Guardian Nurses allows clients to purchase advocacy services based on an hourly model instead of a per-member, per-month premium.
I was more interested in something which is what Guardian Nurses was able to deliver. That you purchase a pool of hours, say, for your clients, and when it's used, those hours dwindle down, and when you get to a certain threshold, you replenish the hours.
Guardian Nurses collaborates with their clients, supplementing their services or offering exceptional clinical support. And nurse advocates respond quickly to clients' needs.
I would just say the just client service level is unbelievable. I mean, just above and beyond level of service, and just response time. We have a 24-hour return call policy. They just seem to be reacting at a much quicker rate than what we've seen. So I think that just getting back to people and follow through and follow up has been really great.
Guardian Nurses Advocates are just a phone call away from anywhere in the United States, able to answer questions from private pay patients, brokers, or their clients.
They will get directly involved with a client of ours or one of the other brokers that we might work with, and they'll help them deal with the physicians, hospitals. We can pretty much deal with the insurance companies, but they're very good at dealing with the healthcare system.
Insurance broker David Bannett says he values the personal services of Guardian Nurses.
What they are doing helps our industry because it adds more, more of the personal side to the insurance business, and we need that. We need to be less of a gray suit and more of a helping hand.
Guardian Nurses provides the service that we cannot provide, and I think it fits in perfect to everything else that we do, like icing on the cake, if you will.
Tom Lamb, Administrator for Law Enforcement Health Benefits, which represents 7,500 Philadelphia police officers and their families, hired Guardian Nurses in 2005. In 1 year, Guardian Nurses helped the LEHB save more than $1 million in health care costs. Lamb says it's partly about saving money, but also about serving his members.
When we call Guardian Nurses, or we have a member call Guardian Nurses, we have a computer program that says callbacks, and we call every one of them back. And in most cases, once Guardian Nurses is involved, depending on the severity of the medical situation, before we call them, they are calling us saying thank you, which is a tremendous compliment to Guardian Nurses.
Jim McCafferty is one of those union members. Last November, just after his heart surgery, he was placed in a rehab center for people with dementia.
I was completely out of it. I had no idea what was going on.
I found out on Thanksgiving Friday that the people working there just assumed he had dementia.
Fearing Jim would not get the cardiac rehab care he needed, Rosemary called Guardian Nurses. It was the Saturday after Thanksgiving.
I'm so grateful for the woman who called me back. She said, "You sounded so upset that I didn't want to wait until Monday to call you, even though it's a holiday weekend," and I'm just so grateful she called because by then I was at wit's end.
A nurse advocate came to the rehab center the very next day, a Sunday, was able to meet with the doctor and review Jim's history. She continued to monitor Jim's care while he was in rehab, making sure Jim received the physical therapy he needed.
If we didn't have the insurance coverage, it would have been worth every penny if I were paying out of pocket.
There's no downside to it, and that's what I'm looking at. There's no downside.
Bernie Rayner's family knows help from Guardian Nurses is just a phone call away.
Now that we know there's someone we can call when we just don't know which way to turn. If they don't know, they find out where, and that's really comforting and helpful for us.
And Maria Maldonado says she is very grateful for the understanding and compassion of Guardian Nurses.
It was probably one of the nicest experiences I've had with anyone in such a very, very, very difficult time.
Guardian Nurses, for everyone who needs a nurse in the family.
You wouldn't go into the legal system today without an attorney, and I believe that you shouldn't go into the healthcare system without an advocate, and who better to advocate for patients than a nurse?